Hello and welcome. Today we'll be talking about an overview of the Medicare Advantage system. If you are approaching Medicare eligibility or reviewing your current healthcare insurance options, you have likely received mail, heard commercials, and seen ads online about Medicare Advantage plans. Also known as Medicare Part C, these plans offer an alternative pathway for you to receive your standard Medicare hospital and medical benefits. In this video, we're going to look past the marketing noise, structural confusion, and high-energy advertisements to break down how these systems work, what guidelines you need to navigate smoothly, and how to structure your health coverage safely for the years ahead. To understand the basic structure of a Medicare Advantage plan, it is necessary to examine who administers your coverage and how claims are processed. When you choose to enroll in a Medicare Advantage plan, it does not mean leaving the federal Medicare program. You remain a Medicare beneficiary, but you choose to receive your Part A hospital insurance and your Part B medical insurance benefits through an approved private insurance company instead of original Medicare. The private insurance company enters into a contract with the Centers for Medicare and Medicaid Services, or CMS, to act as the primary administrator and payer for your medical care. This means that when you visit a provider or check into a facility, it is the private insurance company, not the federal government, that processes, evaluates, and pays those claims based on the specific details of the plan you have chosen. A primary feature that draws many individuals toward Medicare Advantage plans is operational simplicity and bundling. In the traditional framework of original Medicare, an individual must navigate separate pieces of coverage, often coordinating Part A, hospital benefits, Part B, medical benefits, a standalone Part D prescription drug plan, a separate Medicare supplemental policy, and if you want ancillary coverage, a separate dental and vision plan. That's a lot of ID cards and things to remember. Medicare Advantage plans change this approach by rolling your hospital care, outpatient medical services, and prescription drug coverage into one single coordinated insurance policy. Most of these plans will also have extras such as dental, vision, and hearing built into this single plan as well. Once you go to a pharmacy, a hospital, a primary care physician, or your dentist, everything is managed and verified through one single insurance card, removing the logistical burden of juggling multiple ID numbers and separate insurance carriers. You will frequently see these plans heavily cross-advertised on television and in print media with a focus on a $0 monthly premium. For educational and objective analysis, it is vital to understand exactly how this premium structure operates. A $0 premium plan does not mean that your Medicare coverage is free to enroll in or maintain any Medicare Advantage plan. You must continue to pay your standard monthly Part B premium directly to the federal government. This standard Part B premium is often deducted automatically from your Social Security benefit check or billed quarterly. The $0 designation simply means that the private insurance corporation does not charge you an additional monthly premium on top of what you are already paying to Medicare for your basic Medicare coverage. The insurance company is compensated directly by the federal government for taking on your medical risk, which allows them to offer these entry-level premium plans in many regions across the country. Speaking of highly advertised, it is also important to understand that all Medicare Advantage plans in a certain geographical area are receiving roughly the same amount of money from Medicare to take care of your health care. If an ad touts that it is just as good as another, but their plan gives you all sorts of additional perks too, there is always a catch. When a Medicare plan adds new features, it often compensates by reducing or restricting other benefits. Always look past the advertising to find the hidden costs. While original Medicare functions as a unified nationwide system, allowing you to seek care from any provider in the United States who accepts Medicare, Medicare Advantage plans are structurally and legally localized. Their availability, copayment schedules, cost structures, and supplemental benefits are tied directly to a specific geographic service area, usually defined by county lines and zip codes. Medicare plans can vary significantly by location. A plan offered by an insurance company in one county may have completely different copays, provider networks, or prescription policies than a plan offered by the exact same company just one zip code away. This localized framework requires careful geographical screening before selecting a policy. It is also a reason why it can be ill-advised to obtain a Medicare Advantage plan from a national call center. Does the person on the other end of the phone truly understand the specifics of the market in which you live? Because these plans are managed care systems run by private insurance companies, they utilize established networks of contractually bound doctors, specialists, and hospitals to coordinate and control care. The two most prevalent network structures you will encounter are health maintenance organizations, or HMOs, and preferred provider organizations, or PPOs. Understanding the technical operational differences between these two designs is mandatory when selecting coverage. With an HMO plan, you are generally required to receive all of your non-emergency medical care from providers who have agreed to the terms of your network and accept that insurance plan. If you choose to see a doctor or visit a hospital outside of that network, the plan will typically deny coverage entirely, leaving you completely responsible for the full financial burden of that care. Some plans have added additional benefits to their plans to allow you to travel outside your service area. This can be in the form of a national HMO network, in which if you see a doc that is in network in another state with that insurance company, you are still considered in network, or in the form of what is commonly referred to as a travel advantage. This option may give you a certain amount of non-emergency coverage while traveling out of your state, or may agree to use what is referred to as Medicare assignment when receiving care in certain areas or in certain states. A PPO plan offers a different, more flexible network configuration, but typically comes at a higher out-of-pocket cost. Under a PPO structure, you maintain the contractual freedom to see out-of-network doctors, specialists, or hospitals without needing an explicit referral from a primary care physician. However, the insurance company incentivizes you to stay in network by charging much lower co-payments or co-insurance when you use their preferred providers. If you choose to exercise your freedom to go out of network under a PPO, your out-of-pocket cost sharing will be significantly higher, and the amount you must pay toward your deductible may be tracked under a separate out-of-network schedule. If you highly value flexibility and are willing to pay a little more for services or for your monthly plan cost, a PPO may be the right option. When you receive medical care under a Medicare Advantage framework, your financial responsibility is typically calculated using a system of predictable fixed co-payments for each specific service or procedure. This differs from original Medicare Part B and its flat 20% co-insurance model. For instance, you might pay a fixed copayment of $10 to see a primary doctor, $40 to see a specialist, or a set per day fee for an inpatient hospital stay. To shield consumers from catastrophic financial exposure, federal regulations mandates that every Medicare Advantage plan include a maximum out-of-pocket limit. This out-of-pocket maximum acts as a strict safety cap. This is one of the key components that limit potential financial exposure on a Medicare Advantage plan, unlike the uncapped benefits of Medicare Part B's 80/20 benefits. On these plans, if your accumulated copayments and deductibles for covered medical services reach that specified threshold during a single calendar year, you pay $0 for all covered Part A and Part B medical services for the remainder of that year. It is important to know that this cap applies only to covered medical treatments. It does not factor in monthly plan premiums, your prescription drug costs, ancillary benefits such as dental, vision, and hearing, or non-covered optional procedures. One of the areas of these plans in which you must exercise caution when determining your plan is in navigating the cost rules and clinical safeguards of managed care. Unlike original Medicare, where utilization management is more minimal and you can see any doctor nationwide who accepts Medicare assignment, private insurance carriers use internal clinical guidelines to evaluate and approve care before it is rendered. The primary mechanism used to control utilization is known as prior authorization. Under a prior authorization rule, your physician or medical team cannot simply schedule a specialized treatment, advanced imaging scan, planned surgery, or home health service on their own authority. They must submit the clinical documentation to the insurance company's medical review board ahead of time to prove that the requested procedure meets the insurer's criteria for medical necessity. If you move forward with a specialized medical procedure or check into an elective facility before the insurance company has officially granted this prior authorization, the plan retains the right to deny the claim. Despite what you may hear, as long as a doctor or care team has a good, sound medical reason to perform a test or procedure, they are usually approved. Most prior authorizations that are denied are missing some of the required documentation. When there are no missing documents, denial rates are actually very low with most insurance providers. However, this is a potential negative for this type of plan. Let's move on to something that most people love about the Medicare Advantage system, and that's the extra benefits. This represents a significant structural difference between Medicare Advantage and traditional Medicare. Under the guidelines of original Medicare, the federal government explicitly excludes coverage for items such as routine dental cleanings, extractions, root canals, dentures, routine eye exams, eyeglasses, contact lenses, routine hearing tests, and hearing aids. If you remain on original Medicare, you must absorb 100% of those routine expenses out of your own pocket unless you purchase a separate additional policy at an additional monthly cost. Medicare Advantage plans utilize federal funding allocations to bridge these gaps by building dental, vision, hearing, and wellness benefits directly into their core plan structures. These extra benefits are not standardized and may vary drastically between plans, so it is important to look at these benefits closely when shopping for a plan. For example, a plan may say includes dental benefits, but this might be structured as a preventive-only package, covering 2 routine cleanings and x-rays per year at zero cost, but providing zero coverage if you require a crown or deep periodontal work. Other plans may offer a comprehensive dental allowance, such as $1,000, $1,500, or even $3,000 per year for covered dental expenses. Some plans allow you to visit any dentist, while others require you to use a specific network of providers to receive care. Vision and hearing benefits typically operate under similar managed care constraints. A plan may cover 1 routine eye exam per year and offer a set hardware allowance, such as $150 every 1 or 2 years, that you can use towards frames or lenses, provided you purchase them through an approved optical network retailer. Hearing care typically includes a covered annual diagnostic hearing test and will usually have an allowance or fixed copay for hearing aids. This coverage, however, is often restricted to specific hearing aid brands or models available through a designated third-party vendor contracted by the insurance carrier. Many plans also integrate over-the-counter allowances, providing a set dollar amount each quarter for you to purchase basic medical supplies like bandages, aspirin, or vitamins through an online catalog or participating local pharmacies. Gym memberships, fall prevention devices, and localized transportation to medical appointments are also common inclusions. While these extra perks add clear daily use value, they should never be the sole reason that you select a plan. The core medical network and hospital cost sharing should always remain your primary focus. I cannot tell you how many times we have seen individuals move to a plan promising more goodies, only to find out they can no longer see their doctor, or that MRI they needed is all of a sudden a few $100s more expensive. A very important reality of the Medicare Advantage ecosystem is that provider networks can shift, and plan guidelines, co-payment schedules, or drug formularies can adjust from year to year. A doctor or hospital system that is actively participating in your plan's network this year may not remain in that network for the following year. Hospital groups and private insurance corporations renegotiate their payment contracts every few years. If network agreements break down, a prominent specialist or entire healthcare system can drop out of your network, leaving you to either find a new in-network physician, absorb the out-of-network costs out of pocket, or change insurance plans. Not to worry, Medicare gives you an opportunity every year to defend against these changes and allows you to maintain complete control over your selected plan. Medicare establishes standard annual enrollment windows. The most critical timeline to track is the annual enrollment period, which runs every single autumn from October 15th through December 7th. During this time frame, every Medicare beneficiary has the unrestricted right to review their plan's upcoming changes, evaluate plan changes, look at newly introduced drug formularies, and switch plans or coverage directions entirely. Any selection you make during this annual enrollment period becomes effective on January 1st of the upcoming calendar year. Additionally, for individuals who are already enrolled in a Medicare Advantage plan as of January 1st, the government provides a secondary guardrail known as the Medicare Advantage Open Enrollment Period, which runs from January 1st through March 31st annually. During this first quarter window, you might discover that your plan's network has changed unexpectedly, or that your co-payments are higher than anticipated. If that happens, you are permitted to make a one-time switch to a different Medicare Advantage plan, or drop it entirely to return to original Medicare with a standalone Part D drug policy. To learn even more about these enrollment windows, feel free to view our video on enrollment periods as part of our Medicare 101 video series. Because of these moving parts, local doctor networks, county-specific copays, varying prior authorization criteria, and complex prescription drug lists alter their structures constantly. Attempting to navigate the comparison process alone can feel completely overwhelming. This is precisely why partnering with an independent brokerage such as Medicare Made Simple is so beneficial to your long-term security, planning, and peace of mind. It is important to understand the structural difference between insurance agents. A captive insurance agent works directly as an employee for one specific insurance corporation. By virtue of their employment, they are contractually required to promote and sell that single company's products, regardless of whether a competitor has a plan that fits your healthcare needs or budget better. Medicare Made Simple and our brokers operate under a completely different framework. We are 100% independent. We hold zero exclusive allegiances to any single insurance carrier. We do not answer to the insurance corporations. We answer directly to you, serving exclusively as your independent advocate and professional advisor. We utilize specialized comparison software and directory verification tools to run exhaustive cross-carrier comparisons based on your exact medical data. We enter your trusted family physicians, specialized medical clinics, preferred local hospitals, and your current prescription drug list directly into our database. Our systems break it down and tell us which plans cover your doctors and shows us the cost of your medications for each plan provided where you live. Furthermore, we take care of all paperwork and enrollment forms, ensuring that the plan you choose becomes active when you need it. We stay by your side as a continuous year-round resource. If you receive a confusing bill from a clinic, if you get a new medication mid-year you need to figure out, or if you need assistance filing an official clinical appeal, you do not have to call an automated corporate helpline. You call our office directly, and our team helps handle the issue with you. Every fall, we re-verify your data against the newly released guidelines to ensure your coverage remains optimized year after year. Your health choices dictate both your physical quality of life and your financial liabilities for the entirety of your retirement. Relying on an independent professional's expertise entirely removes the stress and burden of managing these shifting federal regulations yourself. Let us handle the carrier comparisons, the compliance tracking, and the enrollment paperwork for you. Contact our office today to schedule your personalized, fact-based consultation. Thanks for watching, and if you found this content helpful, feel free to hit that like and subscribe button to get notified as we continue to create more of these educational videos.